IT band syndrome causes and treatment. Iliotibial band syndrome, also known as IT band syndrome, is the inflammation and irritation of the iliotibial band. Iliotibial band syndrome is one of the leading causes of lateral knee pain in runners, especially long-distance runners. The iliotibial band may tighten, rub across the lateral femoral condyle, and/or thicken or overdevelop from repeated knee and hip flexion and extension. The thickening and tightening action and rubbing motion associated with iliotibial band syndrome are common in runners, bicyclists, high-impact aerobics, weightlifting that involves squatting, dancing, wrestling, gymnastics, rowing, and rock climbing. Iliotibial band syndrome is most often an overuse injury. IT band syndrome symptoms include pain and tenderness on the lateral knee, hip pain and tenderness over the greater trochanter, a snapping pain when the iliotibial band flicks back and forth over the lateral femoral condyle, may hear a popping noise when walking or running. Pain usually dissipates with rest and intensifies with movements that involve knee extension and flexion, swelling between the iliotibial band and the lateral femoral condyle, and knee weakness. Acute stage symptoms are characterized by swelling, redness, pain, and possibly a local sensation of heat, indicating inflammation. If coolness makes your pain feel better, then the acute stage treatment is recommended. Apply the Sinew Herbal Ice on your knee to reduce redness, swelling, and inflammation while dispersing accumulated blood and fluids to help restore normal circulation to the knee. This first aid treatment is used in place of ice to significantly speed up the healing process. It reduces the swelling and inflammation more effectively than ice, allowing you to more quickly regain range of motion. Ice is not recommended because it does not help repair damaged tissues and keeps everything in the injured area frozen, causing the stagnation of blood and fluids and the contraction of muscles, tendons, and ligaments. In Chinese sports medicine, ice is not used and is considered a culprit in injuries that don't heal well. Massage your knee with acute sinew liniments to relieve pain, reduce swelling and inflammation, break up clotted blood and stagnant fluids, and stimulate circulation of blood and fluids to help cells quickly repair damaged tissues. The Sinew Sports Massage Oil is recommended for use before and after exercise, sports, and strenuous activity. It warms and stimulates your muscles, increases circulation, and relieves tightness, hence improving your performance and helping to prevent injury. Chronic stage symptoms begin once swelling and inflammation are gone, but you still feel pain, stiffness, weakness, and/or sensitivity in cold and damp weather. If heat makes your pain feel better, then the chronic stage treatment is recommended. Massage your knee with chronic sinew liniments to relieve pain and stiffness, strongly stimulate circulation and blood flow to damaged tissues, and promote the healing of overstretched tendons and ligaments. Apply the sinew injury poultice on your knee to significantly stimulate circulation and blood flow to damaged tissues, relieve residual pain and stiffness, and further promote the healing of overstretched tendons and ligaments. Soak your knee with the sinew warming soak to bring warmth into the knee to drive coldness out of damaged tissues, increase local circulation, ease joint pain, and increase range of motion. The sinew warming soak is particularly useful if your knee is more painful and sensitive to cold, or hurts more in cold weather. The soak can be used by saturating a towel in the liquid and applying it to your knee. The Sinew Sports Massage Oil is recommended for use before and after exercise, sports, and strenuous activity. It warms and stimulates your muscles, increases circulation, and relieves tightness, hence improving your performance and helping to prevent injury. Thank you for watching. For more videos, subscribe to our YouTube channel. To learn more, visit sinewtherapeutics.com.